There's a moment most of us have experienced, that quiet, nagging feeling that something in our body just isn't quite right. Maybe it's a fatigue you can't shake, a pain you keep pushing aside, a change you've noticed but haven't yet dared to look up. You tell yourself it's nothing. You wait. And the days turn into weeks. I'm Dr. Naira Stein, your senior's health and wellness consultant, and if there's one thing I've learned over years of working with older adults, it's this. The warning signs our bodies send us are never random. They're messages, sometimes subtle, sometimes urgent, and learning to read them could quite literally be the most important thing you ever do for your health. If you're here because you care about staying well, staying independent, and living with vitality in your later years, then you're in exactly the right place. Stay with us, because today we're going to talk about 5 signals your body may already be sending you. Signals that are far too important to ignore. Why we dismiss the signs. Let's be honest for a moment. Most of us, and I say this with great compassion, are remarkably good at explaining away the signs our bodies give us. I'm just tired because I didn't sleep well. That pain in my chest is probably just indigestion. My vision is blurry because I've been staring at screens too long. And sometimes those explanations are accurate. But sometimes, and this is what I need you to hear, they are the story we tell ourselves because the alternative feels too frightening to face. The truth is that our bodies are extraordinarily intelligent. Every cell, every organ, every system is part of an incredibly complex network that is constantly working to maintain balance. When something begins to go wrong, when a blood vessel strains under pressure, when a nerve misfires, when inflammation silently spreads through tissue, the body responds. It sends out signals, and those signals deserve our full attention. Now, I want to be very clear, this video is not meant to frighten you. Fear is the last thing I want to plant in your mind. What I do want to give you is awareness, the kind of calm, informed awareness that empowers you to take action at the right time, rather than waiting until a small problem has become a large one. As we grow older, our bodies change in ways that are natural, expected, and in many cases, manageable. But one of the most important shifts that happens as we age is that our warning systems can become quieter, or we can simply become accustomed to low-level discomfort in a way that makes us overlook it. High blood pressure, for instance, is called the silent killer for good reason. Most people feel absolutely nothing until the damage has already been done. Type 2 diabetes can develop gradually, with symptoms so mild they're easily dismissed. Early signs of heart disease, kidney stress, even certain cancers, they often arrive not as dramatic alarms, but as soft, persistent whispers. This is why I believe that one of the greatest gifts we can give ourselves, and the people who love us, is the commitment to actually listen, to notice, to act. So let's walk through these 5 warning signs together. And as we go, I want you to be honest with yourself. Not anxious, not alarmed, just honest. The 5 warning signs, causes, and symptoms. Warning sign number 1, persistent, unexplained fatigue. Tiredness is something we all experience. A poor night's sleep, a busy day, a demanding week. These can all leave us feeling drained. That's normal. But there's a very different quality to fatigue that lingers. The kind that doesn't improve after a good night's rest. The kind that seems to press down on you even when you haven't done much at all. This type of persistent, unexplained exhaustion can be one of the earliest signals of something far deeper. Conditions like anemia, where your red blood cell count drops and your body struggles to carry oxygen efficiently, can cause this exact kind of bone-deep tiredness. So can thyroid dysfunction, where the gland responsible for regulating your metabolism begins to slow, leaving you feeling as though everything in your body is running at half speed. Heart disease can also present this way, particularly in older adults and women who may not experience the dramatic chest-clutching symptoms we associate with cardiac events. Instead, they feel profoundly tired, breathless with minimal exertion, low in a way they can't quite explain. Kidney disease, diabetes, certain autoimmune conditions, and even some forms of depression can all manifest first as unexplained persistent fatigue. So ask yourself, is my tiredness something I can trace to a cause, or has it simply settled over me without explanation? If it's the latter, please speak with your doctor. A simple blood panel can illuminate a great deal. Warning sign number 2. Changes in urination. This is a topic that many people feel embarrassed to bring up, and that embarrassment can cost precious time. I want to encourage you, warmly and directly, to remove any shame from this conversation entirely. Changes in how often you urinate, the color and clarity of your urine, any pain or burning sensation, blood in the urine, or a feeling that your bladder never fully empties. All of these are messages worth taking seriously. In men, increased urinary urgency or difficulty, particularly at night, can be an early sign of an enlarged prostate, a common condition that responds very well to treatment when caught early. Left unaddressed, it can progress to more significant complications, including urinary tract infections and kidney stress. In both men and women, blood in the urine, even a single instance, even if it appears and disappears, should prompt an immediate conversation with a physician. It can indicate a urinary tract infection, kidney stones, or in some cases, early bladder or kidney disease. Excessive thirst combined with frequent urination is a classic hallmark of uncontrolled blood sugar, one of the primary warning patterns of type 2 diabetes. Foam or froth in the urine can indicate that protein is being passed, a sign the kidneys may be under strain. Your urine is one of the simplest, most accessible windows into your internal health. Pay attention to it. Warning sign number 3. Swelling in the legs, ankles, or feet. A certain amount of swelling in the lower limbs at the end of a long day, particularly in warm weather or after prolonged standing, is not uncommon, but swelling that persists, worsens over time, is present in the morning, or comes with other symptoms, is a different matter entirely. The heart, kidneys, and liver all play crucial roles in maintaining the body's fluid balance. When any of these organs begins to struggle, fluid can accumulate in the tissues, particularly in the legs and feet, where the effects of gravity are strongest. Heart failure, a condition that affects millions of older adults, often first presents as swelling in the ankles and lower legs, sometimes accompanied by shortness of breath or a persistent cough. The heart, unable to pump efficiently, allows fluid to back up into the surrounding tissues. Kidney disease can produce similar swelling as the organs lose their ability to filter and excrete excess fluids. Liver conditions, including early cirrhosis, can cause the abdomen and legs to swell as fluid accumulates in the body cavities. Chronic venous insufficiency, where the valves in the leg veins no longer work properly, is another common culprit in older adults, and while often less immediately dangerous, it can significantly affect quality of life and, if untreated, lead to skin changes, ulcers, and infections. If you notice persistent swelling, press gently on the skin of your ankle. If your fingertip leaves an indentation that takes a moment to fill back in, that's what doctors call pitting edema, and it warrants professional evaluation. Warning sign number 4. Sudden or gradual changes in vision. Vision naturally changes as we age. Reading glasses become necessary. Things in our peripheral field may not be quite as sharp. These gradual shifts are expected, but certain visual changes carry a very different weight and deserve immediate attention. Sudden loss of vision in one or both eyes, even if it's brief and seems to resolve, is a medical emergency. This can be a sign of a transient ischemic attack, commonly called a mini stroke, where blood flow to the brain is temporarily interrupted. In these moments, the window for treatment is narrow, and time genuinely matters. New floaters, dark spots, cobwebs, or flickers of light that suddenly appear in your visual field can indicate a retinal tear or detachment, which again requires urgent care. The retina, the light-sensitive layer at the back of the eye, can begin to separate from its support tissues, and if not treated quickly, this can result in permanent vision loss. Gradual blurring in the center of your visual field, difficulty seeing fine details, or distortion where straight lines appear wavy. These are classic early warning signs of age-related macular degeneration, one of the leading causes of vision loss in older adults. Increased sensitivity to light, halos around lights at night, and progressive clouding of vision are hallmarks of cataracts, highly treatable, but again requiring timely care. Your eyes are among the most extraordinary structures in your body. They deserve regular professional attention, and any sudden or unexplained change deserves prompt evaluation. Warning sign number 5, unexplained weight loss. In a culture that often celebrates weight loss, this one can be easy to misread, even to celebrate. But unintentional weight loss, losing significant weight without deliberately trying, is one of the most important signals the body can send, and one of the most frequently overlooked. Losing more than 5% of your body weight over a period of 6 to 12 months without any change in diet or activity level is a threshold that physicians consider clinically significant, and the list of conditions it can signal is broad and serious. Cancer is perhaps the most widely known cause of unexplained weight loss, and while I name it here not to alarm you, but because honest information matters, it's worth knowing that early detection dramatically changes outcomes across virtually every cancer type. But there are many other explanations. Hyperthyroidism, an overactive thyroid, can accelerate metabolism to the point where the body burns through its energy stores and muscle mass faster than food can replace them. Diabetes can cause significant weight loss as the body, unable to use glucose properly, begins breaking down fat and muscle for fuel. Depression and anxiety, particularly in older adults, can suppress appetite so profoundly that significant weight loss occurs. Chronic infections, inflammatory conditions, and gastrointestinal disorders such as celiac disease can interfere with the body's ability to absorb nutrients even when food intake is adequate. If you or someone you care about has lost a noticeable amount of weight without trying, please don't assume it's simply stress or aging. Ask the question, run the tests, know the answer. Taking the first step. I want to speak to something that I know holds many people back from seeking care, and that's the fear of what they might find out. It's deeply human. When we sense that something might be wrong, there's a part of us that believes that not knowing is somehow safer than knowing. I understand that feeling, but let me offer you a different perspective. Knowledge is not the enemy. Early knowledge is, in fact, one of the most powerful tools we have. When conditions are caught in their early stages, whether it's hypertension, diabetes, kidney disease, a thyroid imbalance, or even certain cancers, the treatment options are broader, gentler, and the outcomes are dramatically better. It is in the later stages, when we've waited too long, that our choices narrow. What to do when you notice a warning sign. The steps are simpler than you might think. First, and most importantly, speak to your primary care physician. Describe what you've observed in as much detail as you can. When did you first notice it? Has it changed? Is it associated with anything else? A good doctor will ask these questions anyway, but offering the information proactively helps guide the evaluation. Second, keep a simple record. A small notebook, a note on your phone, jot down dates, what you noticed, how long it lasted, any other symptoms present at the same time. This kind of precise information is remarkably valuable and can help your doctor identify patterns that might otherwise take longer to surface. Third, don't downplay your symptoms to your doctor. I know this sounds obvious, but so many patients, out of a desire not to seem dramatic or a deep-seated wish that the symptom is nothing, describe their experiences in minimized terms. Say what you actually feel. Describe it accurately. Your doctor is on your side, and the more truthful the information you provide, the better they can serve you. Most warning signs that warrant attention can be investigated through straightforward tests: blood work, urine analysis, blood pressure monitoring, an eye examination, and ultrasound. These are not frightening procedures. They are simply information gathering, and information, as I said, is a gift. Lifestyle foundations that support early intervention. While we're on the subject of taking care of ourselves, I want to briefly acknowledge the foundational habits that reduce the risk of many of these conditions developing or progressing in the first place. Quality sleep, at least 7 to 8 hours for most older adults, remains one of the most powerful and undervalued tools for health. During sleep, your body repairs damaged cells, regulates hormones, manages blood sugar, and maintains the kind of metabolic balance that keeps illness at bay. A diet rich in vegetables, fruits, whole grains, lean proteins, and healthy fats provides the raw materials your body needs to function and repair itself. Hydration. Drinking adequate water throughout the day supports kidney function, circulation, and cognitive clarity. Regular movement, even something as gentle and accessible as a daily walk, maintains cardiovascular health, supports healthy blood pressure, helps regulate blood sugar, and keeps the muscles and joints that carry us through life in better condition. And annual checkups, even when you feel well, create a baseline and a relationship with your healthcare provider that pays dividends when something does need attention. We talk a great deal in medicine about early detection, about prevention, about clinical thresholds and diagnostic criteria, and all of that matters enormously. But at the heart of all of it is something far simpler: the decision to take yourself seriously. Your health is not a luxury. It is not something to attend to when you have the time, when things slow down, when you feel like the symptoms are bad enough. Your health is the foundation on which everything else in your life is built: your relationships, your independence, your joy, your contribution to the people around you. The 5 warning signs we've discussed today are not meant to fill you with worry. They are meant to fill you with wisdom. The wisdom to listen to your own body, the wisdom to act early, the wisdom to understand that seeking help is not weakness. It is, in fact, one of the most courageous and loving things you can do for yourself and for those who need you. So if you've been living with something you've been meaning to get checked, let today be the day you make that appointment. Let today be the point at which you choose to know rather than wonder. Your body has been carrying you through every moment of your life. It deserves your attention, and so do you. I'm Dr. Naira Stein, and I'll see you in the next conversation. Take care of yourselves, because you truly matter.